And then there's this conversation. We're bringing in my personal doctor who's seeing me through all of my prenatal care to talk about those pregnancy myths. What's real and what are lies? We're going to talk about that. Is it true that you'll boil the baby if you take a bath? We're going to discuss it coming up. All right, so Jen is a new mom. Everybody knows that, and I'm sure that she went through what I went through. So today we're talking about pregnancy myths, and I have to tell you, this is my personal doctor, Dr. Joey Adashek, taking good care of me and my baby boy with Desert Perinatal Associates. And this whole segment was generated from conversations that we've had during my doctor visits, because there's so many myths about pregnancy. And I have texted you, he's so patient with me. I've texted him multiple times. Is it okay to take a bath? Am I going to boil the baby? Can I have caffeine? Is it, so many things that you hear, especially if you go online. So we thought you would come in today and let's debunk some of these.
Well, you have no idea how many myths there are out there. I'm sure you've heard what you're not allowed to do, and all day long, you're not allowed to do this, not allowed to do that.
And it's scary, especially if this is your first time. So we have some of them. I want to pop them up on the screen. I want to start with this one, because this one was a big one for me. And you told me this is a popular one. Can you drink caffeine when you're pregnant?
So the studies show that it would take an enormous amount of caffeine to might increase the risk of miscarriage in the first trimester.
Okay.
So if your whole source of liquid intake is maybe cappuccino or espresso during the first trimester, that's maybe not something you want to do. But if you want a cup of coffee a day, that's fine.
You actually encouraged me to start drinking it because I was getting headaches.
Right.
Okay, let's move on because I want to get through some of these. Cheese and deli meats, two foods that you hear you can't eat.
Right. I mean, when is the last time that we've seen listeria in cheese that people have eaten, or even in deli meat? I mean, this isn't the 1950s.
Right.
The last time we've heard of an outbreak of listeria in deli meat or cheeses is so long ago. So you can't take away everything out of your diet.
Right. And actually, the thing that we had listeria was Bluebell ice cream, and I had that in my freezer, so you never know. Okay, patients think ultrasounds are harmful.
Right, and it's just sound waves, it's not radiation, you can't even hear it. There's no studies to show that it's harmful, and actually when you're doing ultrasound, you actually spend a lot of time with the screen frozen, so you're actually not doing continuous ultrasound for much longer than even 10, 15 minutes at the longest ultrasound that you could have.
And as a high-risk specialist, you have patients who have to have ultrasounds like weekly or monthly, right?
Yes,
so,
and the newer machines even put out less sound waves than the older machines.
Okay, you can't dye your hair.
You can totally dye your hair. It's not going to cause any problem. I'm sure you never have, but other women, they're not allowed. I mean, they are taught they're not allowed to dye their hair. Of course you could dye your hair.
Okay, I'll admit, I get highlights and stuff. So, okay, you can't have sex while pregnant.
Totally can have it. There's a few instances where we tell people they shouldn't, like preterm labor or the cervical incompetence, but otherwise it's totally fine to have sex.
Okay, you can't take a hot bath. You told me, Michelle, you're not going to boil your baby.
No, you're not going to boil your baby. In the first trimester, you should not get your body temperature greater than 103, 104. You're not going to do that with a jacuzzi or a bath.
Okay, there's so many on here, and we don't. Another one real quick. We have to wrap, but it's okay to exercise.
So okay, exercise. Just don't get the heart rate greater than 140.
Okay, so here's what we're going to do, because we had a list that literally is this long of pregnancy myths. So we posted on our Facebook page, and we want to know what are some of the things that maybe you've heard that you're not sure about. What rumors have you up at night worrying? What do you want to know? You post them on our Facebook page. We'll have Dr. Adashek look at those tonight. He's going to answer those questions for us, and then we're going to share some of those tomorrow on the show. Thank you so much for coming on. I really appreciate it.
Problem.
He's the best. He keeps me calm, and we really appreciate that.
Thank you.
We mean me, the baby, the husband, the mom, Crystal Allen, everybody.
Thank you.
All right, we'll be back after this. Stay with us.